Good morning. I want to thank everyone for joining us today on Tuesday. San Diego continues to really perform well as we work our way out of COVID and we return to a very normal way of life, something that after a very long year and a half, I think we should all take a measure of pride in. According to the case rate data that is out, San Diego County is moving into the lower restrictive yellow tier. This will go into effect tomorrow morning. And it will have an impact on a variety of industries, and I'll share those in a second. But it is exciting news, and obviously we will only be in the yellow tier for 1 week because we look ahead with great anticipation to June 15th, the retiring of the tiers and the moving back to our normal way of life. And I just want to take a moment and commend San Diegans because one of the reasons that we are in the position we're in on cases and hospitalizations is because of the incredible work of San Diegans in getting vaccinated. If you look at our dashboard today, you will now see we are 99% of the way with first shots towards reaching that goal of 75% of eligible San Diegans getting vaccinated. We are 80% of the way towards that goal on those fully vaccinated. And it really is incredible that as we stand here today, we're right on the edge of having 75% of San Diegans receive at least that first dose. This vaccination rate in San Diego County puts us far ahead of every other Southern California county, far ahead of the state of California, and significantly farther ahead than the nation as a whole. And that is a tremendous testament to San Diegans' willingness to get vaccinated and a tremendous testament to our entire healthcare system. And I want to take a moment to appreciate and thank all of the public health workers, the county workers, our healthcare partners, our hospitals, our clinics, everyone who has been a part of this truly massive public health response and making the vaccine widely available in terms of getting it in every community, free, safe, effective, accessible. And obviously our efforts will continue around the vaccine as we move forward. But just really want to thank everyone for the tremendous work that has been done. Again, as I mentioned at the outset, we have been notified that San Diego's case rate has been below 2. Our adjusted case rate is below 2 cases per 100,000 for a second consecutive week, which again means effective tomorrow morning we will enter the yellow tier. We will have 6 days in the yellow tier prior to June 15th where all tiers will be retired. But for the next week, starting tomorrow, informal outdoor gatherings see capacities increase. Private outdoor events see capacities increase. Indoor seated events, outdoor seated events, gyms, bars indoors, restaurants, family entertainment centers, amusement parks, and water parks will all see increased capacity. And if you go to the county website, you can access the exact criteria for the yellow tier, and we stand ready. If any entity has questions, please contact us, and we can help do that. As we enter the yellow tier and prepare for the eliminations of the tiers in June 15th, we will be making adjustments to our COVID response. We will, after next week on June 15th, our press briefings will be on an as-needed basis. We also will be making some changes in how we report out the data. We will continue to share all of the COVID-related information around tests and cases and hospitalizations and vaccination rates. We will just begin changing some of that as we move forward and as we go in a new direction. But we are excited about where we are headed. We are looking forward to retiring the tiers on June 15th. We also, for the duration of June, will have a very concerted effort around our mobile vaccine efforts. Literally a significant number of appointments throughout our county on those mobile sites, along with a very robust effort around static sites still being open. As we go past June, we will be scaling back many of those. The vaccine will continue to be available at multiple locations throughout the county, in addition to all of the places you would normally go to get a vaccine or a flu shot. But we will begin to make changes there. So again, good news on the descending into the yellow tier, looking ahead to the retiring of all the tiers, and again, really good news on San Diego's continued progress with vaccines. With that, I want to invite up Vice Chair Vargas, and then we will be happy to take your questions, and our public health doctors are here as well for any questions that you may have for them.
Thank you, Chair Fletcher. Buenos dias. I am excited to know that we're getting closer to our goal of vaccinating 75% of San Diego County residents and that we're transitioning to the yellow tier, even if it's for a week only. And of course, the state reopening of June 15th is also around the corner. As we start transitioning into a new approach in mitigating the impact of the pandemic, I want to emphasize how important it has been the work that our team at the county has done in partnership with our community partners and organizations. The work that we've done for around COVID testing, vaccine distribution, and other services from an equitable lens, and how important it is to continue to mitigate the impact of the pandemic from this perspective. I am hoping that we'll continue to do that as we're looking at economic recovery as well. It is the investment in this model that's moving us forward today. I'm particularly happy to see that some of our demographic numbers continue to rise. To this date, 57.3% of the eligible Latino population has been vaccinated with at least one dose. This is a jump of 5% in just 1 week. I think all of our intervention efforts are absolutely working. 36.7% of eligible African American residents have also been vaccinated. 64.2% of the eligible Asian American population has received the vaccine, and 99% of the Hawaiian Pacific Islander population has also received one vaccine. I'm also really proud to share that with you that we've expanded our pilot program that we mentioned to all of you about the vaccinating the maquiladora workers from U.S.-owned companies in Tijuana. I want to thank UC San Diego Health, the Mexican Consulate, and our cross-border partners. Thanks to this collaboration, not only did we administer already the first 10,000 vaccines, the program has now been extended to June 17th. This time, our team's goal is to provide 1,500 vaccines each day for a total of about 12,000. I'm so proud of the county for leading this program and has been an example for our communities along the U.S.-Mexico border. We usually talk about health having no borders and talk about this pilot program being an example of this in our region, and we have received many calls from our border county officials across the country as well. So I'm excited about that. Así que muy buenos días. Cada vez estamos más cerca de vacunar al 75% de la población elegible en el condado de San Diego y haremos la transición a la fase amarilla mañana en la mañana. Esto es importante porque aunque solamente vamos a estar en la fase amarilla por una semana, de todos modos es importante porque vamos a poder tener los restaurantes, por ejemplo, de 25 a 50%, más eventos y otras oportunidades, pero lo importante es que el 15 de junio ya se acerca, en donde el estado de California estaremos en la reapertura del estado en general. Con este cambio estaremos haciendo una transición a una nueva fase de respuestas a la pandemia. Quiero enfatizar que esto es necesario seguir trabajando de una manera equitativa en la distribución de vacunas y servicios y que continuemos a mitigar los impactos de la pandemia en esta perspectiva. Este modelo de equidad ha sido muy exitoso y nos ha ayudado a salir adelante de la pandemia. En cuanto a los números de vacunación en la comunidad latina, esta última semana ha incrementado por 5%. Es ahora el 57.3% de la población latina que ya tiene una vacuna por lo menos. 36.7% de las personas afroamericanas, 64.2% de las personas asiáticas y el 99% de la comunidad hawaiana y islas del Pacífico. También me complace informarles que el programa que estábamos haciendo de vacunación binacional que iniciamos el 24 de mayo ha sido todo un éxito, por lo cual quiero agradecer a UC San Diego Health, al Consulado de México y a todos los colaboradores por este proyecto posible. Este lunes ya llegamos a la meta de 10,000 vacunas y ahora se extenderá el programa al 17 de junio en donde podemos alcanzar hasta 12,000 vacunas. Estoy muy orgullosa que el condado pueda hacer ese tipo de programas pilotos como un ejemplo del poder de la comunidad fronteriza y más que nada porque hemos recibido mucha información de los diferentes condados en la frontera que quieren también hacer este programa. Así que muy emocionados. Por último, este sábado a partir de las 9 de la mañana, como mencionó Chair Fletcher, en Petco Park, la Casa de los Padres de San Diego, tendrá un evento de vacunación. Las primeras 1,000 personas que reciban su vacuna recibirán una playera y la oportunidad de ganar boletos de los padres y dinero efectivo. Así que todos los vacunados tienen y tendrán la oportunidad de ganar una tarjeta de $50 y entrarán en la rifa de 50,000 y $1,5 millones de dólares. No pierdan esta oportunidad de vacunarse y probablemente de ganar premios. Muchísimas gracias y no olviden seguir manteniendo todo lo importante para seguir saludables durante esta pandemia. Gracias.
Thank you, Vice Chair Vargas. We'll now go to our text-in questions.
Okay, this first question is from John Carroll at KPBS. Do you anticipate the board approving staff recommendations on the COVID relief money? When might the recipients actually see the financial help getting to them?
Yeah, thank you. Today, our board will be considering the appropriation and allocation of the federal ARPA funds. I expect our board will adopt a framework along with specifics for each of the areas that we outlined in our framework. And I expect we will move rapidly, both as a part of what we do today and as a part of the budget process upcoming later this month to get those programs launched. And our hope is by summer, folks will be able to benefit from those programs.
This question is from Cody Delaney with iNewsSource, and there are several questions. Do you want them all at once or a little at a time?
We'll take them all at once.
I understand the county extended the deadline for SDSU's evaluation of the COVID-19 hotel sheltering program. Considering the fact that we are still in a public health crisis, what are your thoughts about this delay and what it means for the unhoused people in this program with nowhere to go? And will you commit to making the final report and all of the materials used to put it together available to the public when it's finished? And does he have any concerns over whether the county's contractor has proper training to do this kind of work?
Yeah, thank you. The report, I believe, is important. Our board was clear we wanted a full accounting of this program and this effort to better understand and know exactly what happened here and to guide our efforts as we move forward into the future and consider similar endeavors. And so I think that this report the board called for is very important. I also think it is important enough that if they need a little bit extra time in order to complete it, we would rather wait a few weeks to get a complete and accurate report than rush something that might be inaccurate and incomplete. And so I think given the seriousness of the issue, it is appropriate and fine for us to give them a little additional time to make sure we have a complete report. The final report also will be made public, and I look forward to that. As for any concerns, I can't prejudge a report I have not seen. So when we get the report, we will evaluate it, we will release it, and then we will speak to the findings of the report at that time.
This next one is for Dr. Wooten.
Yep.
Dr. Wooten, this is from, let me tell you who it's from, Matt Hoffman at KPBS. Dr. Wooten mentioned during the board meeting the need to extend the local emergency for COVID-19 past June 15th. Why does she think that's necessary, and will any local restrictions under emergency authorization continue post-June 15? Another question, what's your biggest challenge when it comes to vaccinations?
Well, in answering the first question, I reported about a month ago at a board meeting that the state will continue the state emergency until the end of December or the end of the year, because we still have to manage vaccination of those children 0 or 6 months to 11 years of age. And as stated in my presentation today, there are many other reasons to continue the declaration. And that can continue without having many of the health officers' orders that have been seen so far in place. The local emergency and the health emergency allows us to waive or ease procurement regulations. I read the list out during the board meeting. So we stated it's going to continue until the end of the year because the state still has an emergency and the federal government also still has a local emergency in place. The pandemic is not over. June 15th is not the magic date or bullet for declaring that the pandemic is over. It is not. We are still seeing cases, but things are slowing down, and that's what's important. And until we have, usually with any, outbreak, you monitor it for at least 2 incubation periods. Now, this is a pandemic. I totally understand that. But we need to get to a point where we have no cases for at least 2 incubation periods. And that will help us determine if that happens sooner than the end of the year. That's another thing, but the state will continue it through the end of the year to help with other actions that need to be taken as it relates to vaccination. So turning to vaccinations, what is the most challenging thing right now? Things are dynamic and they change from day to day. At some point, we were having issues with having enough vaccine to vaccinate people. And then at the flip of a switch, it wasn't a dimmer, it was a flip of a switch. We now have more vaccines than we have people that want to get vaccinated, but we have vaccinated a lot of people. And so that's very, very important, and we've created strategies to help incentivize people to get those that have not been vaccinated to get vaccinated. Thank you.
Okay, and this next question is also for you from Lori Weisberg at the Union Tribune. With the imminent reopening of California business without restrictions, should the public have any concerns about the mixing of vaccinated and unvaccinated individuals indoors, whether it's at a Padres game or the grocery store? Even with the removal of the tiered system, might many businesses adopt stiffer guidelines, including mask requirements, which would lead to greater confusion?
Well, I think there's confusion already out there, particularly with the CDC recommendations that every person that's vaccinated doesn't need to wear a mask. And if you look at their graphic, there is no situation where a person vaccinated should wear a mask. But the whole thing with that is, if that means that people that are unvaccinated should wear a mask, and that stigmatizes people. So people may choose not to wear a mask because they don't want to be singled out as being not vaccinated. So I don't have any magic answers here. It's very challenging, and I can imagine that this is very confusing for the public. I think it has to be a personal choice, particularly if you are not vaccinated. If you go into large crowds, you should wear a mask. And if you are vaccinated, there's a personal choice. Some people that are vaccinated will continue to wear masks because they don't feel comfortable doing so. So we will promote the CDC guidance as well as its alignment with CDPH, and CDPH is putting out guidance specifically for wearing masks indoors with mega events, more than 5,000 or more, and outdoor mega events, 10,000 or more. Thanks.
Matt, I really quickly want to provide a little bit of context on the state of emergency. Look, we're in a hypercharged environment at the state level. There is obviously a very motivated and underway political campaign with a lot of it surrounding COVID. And the reality is we're seeing a lot of energy exerted about something that really is a standard and customary process. When you have a fire and you declare a state of emergency, that state of emergency continues beyond, because it is a part of the rebuild, it is a part of the recovery. When we had a hepatitis A issue, that state of emergency continued beyond. If you have an earthquake, that state of emergency continues beyond. There are a lot of fiscal reasons why we do that. The ability to draw down federal resources, the ability to draw down state resources. There are liability insurance protections under the state for disaster workers and essential folks. And so I think what is a standard practice when you're responding to any state of emergency is now really being exploited in a way that I think serves other purposes. But I think the public as a whole should know that what we're doing is a standard practice. When you have a state of emergency, you have a pandemic, you have a disaster, you work your way through it. But that declaration of emergency needs to continue for a variety of financial reasons, fiscal reasons, state and federal reimbursement reasons, procurement reasons, liability reasons. But June 15th, San Diego County, we will align with the state. The tiers will be gone. They will be putting out some guidance for a handful of scenarios and situations. But day-to-day life for San Diegans will revert to as close to normal as we've been in more than a year and a half, and we're certainly looking to move ahead with that. And we'll continue our efforts around recovery and rebuilding and response, and those efforts will be ongoing, but will generally be unseen by most members of the public. With that, I think that completes our questions for today. So thank you, everyone, for joining us, and we will see you next week.